Welcome, builders of the internet. My name is Jessa and I love talking about mental health and/or construction. I started online therapy with Betterhelp soon after the start of the pandemic, and I thought I would talk about the pros and cons of online therapy, typical concerns, why I chose this option, and how my experience has been so far. As always, you can find my sources in the description. My mind. Types of online therapy. There are various kinds of well-being services online, such as sites where you can ask questions to therapists, online chats which are monitored and moderated by qualified professionals, messaging correspondence, say through emails or instant messaging, and phone or video calling. I personally have experience with messaging and phone and video calling, so the rest of this upload will be more orientated around these options. Pros and cons of online therapy. I'll go through the pros first. So 1. Accessibility. Online therapy is a great option for those who can struggle to get out the house or may not be allowed to leave the house. Being in the familiar setting of your own home is usually a more comfortable experience for people too, especially at the start when you're not so confident about opening up to your therapist or counsellor. Flexibility or convenience. This is a huge advantage compared to traditional in-person therapy. When you start online therapy, often there aren't as long waiting times and you can start pretty much immediately. I know I started messaging my therapist within 24 hours, and if you have full-time commitments such as working, it's pretty easy to find times that suit you, as there is a lot more flexibility to have sessions in the evenings. Number 3, time saving. This is pretty similar to the last point, but in addition to having therapy at a time that suits you, you're also able to save time with not having to travel to and from the therapist's office. Number 4, less expensive. In the UK, there is a relatively high threshold in order to be eligible for therapy sessions with the NHS, and you often only get, say, 6 sessions. For in-person sessions, the cost per hour does vary, but for a typical 50 to 60 minute appointment, it tends to cost around £120 to £180. Online therapy, of course, varies too, but tends to range from £25 to £80 for the same length session. Number 5, it's effective. According to various studies, client participants have given pretty positive feedback when it comes to online therapy, generally finding themselves as happy with this forum compared to those who do face-to-face therapy. Some even prefer it as they have a degree of anonymity, for example, those with peers who may have a stigma around seeking help for their mental or emotional issues. I'll now talk through some of the cons. Number 1, no physical presence. With online alternatives, there tends to be a dependence on stable internet connection, so sometimes if there's Wi-Fi issues, this can disrupt the flow and overall effectiveness of the session. Therapists often can't see body language outside what's shown, which can make it harder for them to interpret your feelings, thoughts and behaviours. However, with video calls, there's still a lot of information that they can get with facial expressions, tone of voice, and with the words that you say. Number 2. Handling crisis situations. If there is a crisis situation, say with suicidal thoughts or suffering through a personal tragedy, online platforms may provide the option to send communications as urgent, but it can be difficult to respond as effectively should this happen. Number 3, not all types of therapy are available online. There are some practices which are really difficult to implement online, such as art or music therapy. As well as this, it may not necessarily be suitable for those with more serious psychiatric illnesses, say serious addictions, or those with more complex symptoms of a mental health condition, with cases showing that it's typically not as effective in these situations. Number 4, privacy concerns. As with the fears of many things on the internet, there are some concerns about the confidentiality and privacy. There are some legal concerns too, as therapists could have clients in different countries. So there may be different legal and ethical codes applicable for providing counselling services. In terms of ethics too, there could be different qualifications that counsellors have that might not actually be accepted in your country. Number 5, it's not always covered in your insurance. I think this is more applicable to those in, say, the United States, but not all health insurance providers will include online therapy, so sometimes it could be more cost-effective to you if you utilise the in-person methods. Online reviews. For those who've been on YouTube for a while, there was a past controversy with the promotion of Betterhelp, particularly about the wording in their terms of service. I'm not a legal person nor a therapist, so I don't personally feel like I can explain the justification for these concerns, but I'm going to put links to some useful videos that helped clear these concerns up for me if you want to check those out too. Generally, I would say that whilst, yes, I'm sure that unfortunately people have had really horrible negative experiences online, but there are many people, including myself, who have had positive experiences. With pretty much all online reviews for any product or service being provided, there is probably inevitably going to be negative reviews, some justified and some not so much. Even people who provide in-person counselling sessions will have positive and negative reviews on their websites too. Why did I choose online therapy? The main reason that I chose online therapy was because of the flexibility. I have both work and university, which means I'm basically only around in the evenings, but thanks to my counsellor being in the United States, it means that my evening is their daytime, so they can accommodate for my availability pretty easily, and I don't have to travel back and forth, which also saves me a bunch of time. I felt like I really needed therapy because I've been doing a lot of self-reflection and was really finding it hard to be okay with myself, given how I can be quite hot-headed and super irrational and erratic in certain situations. I just really wanted to work on myself and finally get to a point where I could just be happy and also just proud of who I am. There's obviously a lot more complex stuff to it, but that's the general gist, and it's been such a blessing for me, especially throughout the pandemic lockdowns, because it helps add some kind of regularity to my life outside of work and uni, and has given me great means to take care of my mental well-being in these difficult times. How has my experience been with Betterhelp so far? I've not been sponsored by Betterhelp at all, but I have been using them for over 6 months now, so I reckon I can give a fair evaluation of my experience. It took me about a day to be matched with my counsellor, and we messaged for the first week or so, before starting weekly video and phone sessions. After about a month, I became more comfortable with them, and whilst I think that their punctuality was a bit questionable, that kind of really worked for me because mine can be quite bad too, and they always strive to give me the full hour, if not a bit more where necessary. We've mainly practiced talk therapy, have gone through more specialised journaling exercises, and dabbled into EFT for a bit, until we found out what worked best for me. In terms of the cost, because I am a student, I get a subsidised rate, which means I spend about £25 a week. When I've had to contact customer service about, say, pausing my membership for a while, or having missed some sessions, they've been quite accommodating and responsive, and have extended my membership as requested. But I would say it does get a bit confusing because I'm always receiving replies from different people, even if it's to do with the same query. So sometimes the people replying can have varying levels of helpfulness. Overall, I would say it's been a pretty positive influence on my life, and I am glad that I get on with my counsellor really well. If you find that you don't necessarily click with your counsellor as you would like to, it is pretty easy to switch on Betterhelp, which is a nice feature. If you are considering online therapy, do think about the pros and cons for your own situation, because the circumstances and efficacy will vary. Online therapy definitely isn't for everyone, and I wouldn't force it upon anybody, but as a tool for helping maintain my well-being and working through my issues, I would certainly say that it's been a huge help. That's all I have to say for now. I hope it helped build on your mind. Thanks for watching this channel, it's building on my mind. Check out my other videos, but first hit the bell and comment, like, subscribe. Please, it really helps with you.